Hi, I'm Dr. Alexandria Euclidia, and welcome to the Healthy Weight and Wellness Center. We're glad you're interested in our medically supervised weight management program. It's important to know you're not alone in your weight loss journey. Did you know that 2 in 5 U.S. adults are affected by obesity? This shows how common this health concern is. So, what is obesity? Obesity is a complex, chronic, and progressive disease where the body has too much fat. It happens because of an abnormal energy regulation system that controls how much body fat one person should carry. It is not curable, but is treatable. Too much body fat can lead to serious health problems, such as heart disease, stroke, type 2 diabetes, high blood pressure, joint pain, breathing problems like asthma and sleep apnea, fatty liver disease, depression and anxiety, fatigue, and infertility. Adults with obesity also have higher risks for many types of cancers and cancer recurrence. Many things can affect your weight. Rarely is there just one cause. It's a complex interaction between genetics, lifestyle, and our environment. Some contributing factors include eating high-calorie and low-nutrient foods, low levels of physical activity, family history of obesity, stress and lack of sleep, unhealthy gut bacteria, certain medications and health conditions, and community and cultural factors. Obesity is not just about willpower. It's a complex disease that needs long-term care and support from highly trained professionals in the field of obesity medicine. Without support, many individuals who try to lose weight on their own experience weight regain. Even patients taking weight loss medications or who have had surgical interventions like gastric bypass can experience weight regain. This is because your body protects its fat mass. It's a disease that fights back. As you lose weight, your body tries to restore that weight by changing your metabolism and hunger hormones. These are called metabolic adaptations. Our medical providers are board certified in obesity medicine. This means we have additional training and can apply the latest knowledge, science, and pharmacotherapies to create a comprehensive weight management plan tailored to your needs, ensuring you receive the best possible care. So what can you expect at your new patient appointment?
So at your new patient visit, we will do a variety of tests to evaluate your health and look for things that can contribute to obesity.
At your first new patient intake appointment, you'll have your new patient packet completely filled out. And why that's helpful is that it gives us a very detailed medical and emotional history of what has brought you to our clinic.
You'll see one of our providers who will go through your health and weight history based on our extensive new patient paperwork. You'll also get a resting EKG, an indirect calorimetry test, and stand on our bioimpedance scale, which analyzes your body composition. You will also stand on that bioimpedance scale every time you come to the clinic.
And in order to obtain the best results from these tests, you need to be fasting at least 8 hours prior to that first appointment, and that means only water, nothing else by mouth, and no smoking nor exercise.
You could take all of your medications that normally do not need to be taken with food.
At this visit, you will be given an eating plan based on your metabolic testing results and asked to follow this until your follow-up visit 2 weeks later.
At your second appointment, 2 weeks later, you'll go over all of your lab results with your provider. You'll also discuss how your eating plan went and whether or not there were any obstacles, including hunger, cravings, or meal preparation. There are many medication options that may exist once you and your provider decide whether or not you qualify for any of these.
Here at Healthy Weight and Wellness, we're aware of the challenges that you have with the disease of obesity.
This is not a time-limited program. Obesity is a chronic disease that requires follow-up even after you reach your goals.
Typical follow-up for success in the program is that you'll be seen every 2 weeks for the first 3 months, and then every 3 to 4 weeks thereafter.
We tailor your plan based on your health condition, your goals, and your preferences.
The 4 pillars of nutrition, physical activity, behavioral, and medical interventions guide our treatment plans. We will provide behavioral coaching to improve your eating and activity habits. We also have a psychologist on staff who will help you examine, challenge, and improve your relationship with food.
Persistent physical activity is essential in improving cardiovascular and metabolic conditions. It will also preserve muscle mass, which will increase your metabolism and keep weight off.
Fortunately, we now have numerous medical therapies for when lifestyle changes alone are ineffective. This may include FDA-approved medications, referral for a minimally invasive endoscopic procedure, or a referral for bariatric surgery. Not everyone needs or benefits from these interventions, and that is why an individualized approach is crucial for weight loss management and success.
Thank you for the opportunity for us to share our information about Healthy Weight and Wellness program.
If you feel like our approach is consistent with your goals, we would love to welcome you to our program.
We are now serving 2 convenient locations, one on Wendover Ave in Greensboro and the other at Weldon Village in Kernersville. Feel free to call our clinic. We would love to have you.